We're very fortunate in CLL that we have a number of effective new novel agent-based therapies, but unfortunately one group that has not benefited from these agents as much is patients with Richter syndrome, an aggressive transformation of CLL. We know that we can get some patients into a complete response with chemotherapy-based regimens, and we also saw a strong signal of activity for Venetoclax as a monotherapy in patients with Richters from the phase 1 study of Venetoclax. And so our CRC043 study is a combination of Venetoclax with dose-adjusted R-EPOCH, specifically for patients with Richter syndrome of CLL. The design of the study involves a cycle of R-EPOCH given alone to cytoreduce, and then a rapid escalation of Venetoclax with daily ramp-up from 20 milligrams up to 400 milligrams over the course of 5 days. And we did that because we expected these patients to have aggressive disease, and we didn't want to wait the usual 5 weeks to ramp up the Venetoclax. This is done in the hospital, and the patients then stay in the hospital to get a cycle of combination Venetoclax with R-EPOCH, with the Venetoclax given days 1 through 10 of each cycle, and they can receive up to 6 cycles of the total therapy of R-EPOCH in combination with Venetoclax. Patients who are eligible for allotransplant can go on to receive an allotransplant, and those who are not often have gone on to Venetoclax maintenance on the trial. So far, the results of the study are very encouraging. We're presenting the data here at Lugano for the first time, and it's an interim analysis looking at the 26 patients that we've treated. We've generally seen manageable toxicity for most patients, although some of the older patients have struggled with cytopenias, and we've had some significant infections in those patients. But the majority of patients have done well with the tolerability of the regimen, and the responses we have seen have been quite encouraging so far. So we've had 18 patients who have received at least some combination therapy and then received a response evaluation. And of those 18 patients, 12 have achieved complete remission, so a 67% rate of complete remission, which does compare favorably to historical rates of about 20% with R-EPOCH alone. All of these patients who achieved CR also had MRD undetectable CLL, and the durability of response has been good so far, with several of the patients moving on to allogeneic transplantation, and a few of those patients now out 1 to 2 years post-allotransplant still in remission. So overall, we think it's a very encouraging result. We think that as we move forward, we'd like to expand this study and maybe try to de-intensify the chemotherapy component to try to reduce some of those infections. And to do that, we're hoping to use additional novel agent-based combinations with chemotherapy.